Okay, then I'm going to go ahead and start. Okay, have a wonderful presentation.
Should we stop our videos first?
Sure.
Okay.
Okay. All right, well, good afternoon, everyone. Thank you for joining the webinar. We're going to give a couple more minutes for people to come in and settle down, and we'll get started shortly. Thank you. All right, well, good afternoon, everyone. We'll be starting the webinar in just a moment. Thank you for joining. All right. Well, thank you everyone for joining the webinar. We're just going to give another minute or two and we'll go ahead and get started. Thank you. Okay. All righty. Well, good afternoon, everyone, and thank you for joining the Sacramento County Sugar-Sweetened Beverage Guidance for Dental Professionals webinar. My name is Keiko Miyahara from UCSF, California Oral Health Technical Assistance Center, and I'll be hosting today's presentation. So this webinar showcases the continuing education course created by the Sacramento County Oral Health Program for dental professionals to assist them in offering sugar-sweetened beverage reduction guidance to patients in their care. The program coordinator, Jan Resler, will be providing an overview of the project and will explain how you can use the Protect Your Sweet Smile, Sugar-Sweetened Beverages, and Oral Health course as a resource in your community. So some housekeeping before we get started. Everyone is muted, so if you experience any technical issues, please use the chat box to connect for help. Please use the Q&A box to ask questions during the webinar. We'll have a Q&A period towards the end, and this presentation will be recorded and the recording will be available on COTAC's website. And then there'll also be a survey following the close of this webinar, and we kindly ask for your participation. So now I would like to introduce today's speakers. So our first presenter is Jessica Byers. Jessica is a Rethink Your Drink coordinator for the Office of Oral Health at the California Department of Public Health. She has a Master's of Public Health from Walden University and a Master's of Science in Kinesiology from California State University, Sacramento. And our second presenter is Jan Resler. Jan is the Oral Health Program Coordinator for Sacramento County Public Health. Jan has earned a Master of Public Administration degree from the University of Colorado, Denver, and is licensed in California as both a registered dental assistant and a registered dental hygienist. Before joining Sacramento County, Jan taught a clinical dental hygiene to veterinary students at the William R. Pritchard Veterinary Medical Teaching Hospital at the University of California, Davis, and clinical and didactic courses for human patients in dental hygiene programs at Sacramento City and Carrington Colleges. So with that, I would like to welcome Jessica and turn this presentation over to her. Thank you.
All right. Good afternoon, everyone, and welcome. And thank you again for joining today's webinar. We look forward to sharing Sacramento County's training with you all regarding Rethink Your Drink and sugar-sweetened beverage reduction. Before I hand it over to Sacramento County today, I would like to just to provide you with a couple minutes of framework of how the training is relevant to our local oral health plans, work plans. And to start that, I want to just go over the California Oral Health Plan. I'm sure you are all familiar with this as it came out in 2018, and it will still be relevant to 2028. But this is kind of the basis for all of our programs. So goal one of the California Oral Health Plan is to improve the oral health of Californians. So we want to address the determinants of health and also promote healthy habits and population-based prevention interventions to attain healthier statuses in healthy communities. Next slide. And as we dig a little bit deeper into goal one, we'll get to strategy 1.2. And this is really relevant to the Rethink Your Drink activities. And it's to provide dental health professionals with a protocol and tools to screen, counsel, refer, and follow up patients who are affected by common risk factors for a chronic disease. And you'll see that common theme throughout, and Jan will mention in her presentation as well. Next slide. So how is that relevant to our local oral health programs, work plans? Well, as you all know, we're finishing up our work plan cycle from fiscal year 17 to fiscal year 2022. So that will be wrapping up at the end of this month, and then we'll be going into our new work plan. But currently in our work plan, we have Objective 8. And Objective 8 is to address common risk factors for oral diseases and chronic diseases, including tobacco and sugar, and promote protective factors that will reduce disease burden. So I know a lot of you are familiar with this, and a lot of you on the webinar today are probably have selected Objective 8 and have worked on some activities around it. So you're very familiar with your work plan, but there also may be some local oral health programs on today that have not selected Objective 8, but may be interested in some of the Objective 8 activities to reduce sugar-sweetened beverage consumption. So 8.6 of the work plan is to create an inventory of Rethink Your Drink materials and resources. And then we have 8.7 to develop and deliver trainings or webinars on Rethink Your Drink for local dental offices. And then 8.8 to connect dental offices to Rethink Your Drink materials and resources. Next slide. All right, and then moving on into the new work plan, fiscal year 22 to 27. So although the objective number has changed, so previously it's been Objective 8, And for the upcoming work plan, it's objective 4, but the goal is the same. So we still want to address common risk factors for oral disease and chronic disease and promote protective factors that would reduce disease burden. And again, this objective applies to both sugar-sweetened beverage reduction and tobacco cessation. And again, a lot of the activities are the same as a previous work plan. They're just laid out a little bit differently. So I just want to go over them briefly with you if you haven't seen them yet, or if you're already contemplating on how you're going to fulfill these activities. So 4.2, we have to collaborate with local partners to participate in sugar-sweetened beverage reduction activities. 4.2.a is to develop or use existing training materials to deliver on educational sessions trainings for dental offices and school-based programs. 4.2.b, deliver trainings or webinars on healthy beverages to school stakeholders. And 4.2.c, which is to partner with community health workers to develop guidelines to integrate oral health into chronic disease prevention and control activities. So you can kind of see how everything kind of goes together, and we're continuing to build on our work plan that we've done in the previous 5 years and bringing it forward to the next 5 years. Next slide. So that was just a small clip of the activities that are relevant to today and to the training that Sacramento County has developed. Here's the listing of all the sugar-sweetened beverage activities on the next work plan. And remember that tobacco cessation is also a part of this objective, but I haven't listed it here just because today we're just focusing on Rethink Your Drink. And then next slide, please. So as you listen to the presentation today, I just want you all to encourage you all to think about how the training is relevant to the work plan activities that I just shared and how it can fulfill some of those activity requirements. And so with that, I'd like to hand it over to Jan at Sacramento County to reveal her training. Thank you, everyone.
Hi, everyone. Thank you for joining today. As Jessica said, this is for what I'm calling the objective, formerly known as 8. The previous work plan, or the work plan that we're just wrapping up now, really had a higher concentration on providing guidance to dental providers. And so that's where we really started with this project. So I'll give you a little bit of background. To accomplish the goals of this project prior to COVID, our team planned and delivered lunch and learn type presentations in dental offices and larger presentations to local dental and dental hygiene associations. It was always our intention to produce web-based training with the goal of expanding our audience and also to offer those web-based training resources to other counties who are working on this objective. As an incentive to dental providers who participated in or attended our presentations, we applied for and received a permit to issue continuing education credits for presentation attendees. And we thought that that would be a nice way to get the dental providers who are very busy usually to want to attend. Once COVID hit and in-person trainings were limited, we started focusing on developing the Sugar-Sweetened Beverage webinar. We were able to braid funding from 3 sources, the Dental Transformation Initiative Pilot Project, CARES funding, and of course Prop 56 funding. And we worked with a local marketing firm to develop the webinar. One of the interesting challenges we faced was the technology capacity here in Sacramento County, and we needed to find out how and where we were going to post the webinar as our county capacity was limited. We still wanted to offer continuing education credits as an incentive for participation. We were very lucky to be connected to MindMeld Studios. MindMeld is a local company that offers training and education like sexual harassment and those kind of things to a variety of public and private organizations. And they have the capacity to build a landing page where we host the webinar. And also they also are able to provide continuing education credits for attendees, licensed dental providers. So today what I thought is we take you through the landing page that was developed by MindMeld. That landing page you can find at www.saccountylearning.com. You'll see it in a few minutes. I thought we'd view a few minutes of the Protect Your Sweet Smile, Sugar-Sweetened Beverage and Oral Health video. Review the topics that we cover in the video and the accompanying resources, and then talk about how you can use this resource in your community. So I'm going to share my screen here. Okay, don't think I'm sharing the right one. Sorry about that. All right, here we go. Are you seeing it, everyone, or no?
Yes, we see the Protect Your Sweet Smile.
Okay. Oh, that's the one you see? Okay,
Yes.
That's not what I'm trying to do. I'm having a hard time sharing this. My apologies. I had them all popped up, and of course now they're gonna act up on me. We'll try this. How's that?
Yes, we see
Okay,
the
so
website.
this is the saccountylearning.com landing page. This is where we posted the video. What we found in Sacramento County, we're unable to link it to our website. And MindMeld is just terrific in that they are able to offer the continuing education credits. So if you go to saccountylearning.com, this is the page you'll land on. Right now, the Sugar-Sweetened Beverage video is the only video on. However, we've just completed a tobacco webinar as well, and we'll be posting that within the next couple of weeks. So if you scroll down, our public health officer, Dr. Olivia Casirier, did film a promotional video for us. So that was fun. She did it in the MindMeld studios, and we use it as a little marketing clip. If you continue to scroll down, you see the featured course, which right now our only featured course is Protect Your Sweet Smile, Sugar-Sweetened Beverages and Oral Health. This shows the course overview and objectives. And if you click Buy Now, it will take you to the course page. As you can see, we have a $5 list price for this, and we can talk more about how we did this. What we did was when we had got our permit to provide continuing education, we realized that there is a tremendous amount of administration that needs to go into record keeping and tracking for the Dental Board of California. So MindMeld will provide and do all the tracking for $5 per view. So we thought that that was very reasonable. We have added in our program budget a $1,000, so that covers 2,000 views. We use that as an incentive to get providers to come and take the training. If you were to add this to a cart, you would go to the shopping page. You would need to, oh gosh, I've already been in here today, so now it says I have to. You would scroll down and you would click that you're a dental provider, if that's what you are and you want the continuing education, and then you could check out. And once you get to the checkout page, you can either pay or you can apply a discount code. So we have a contract with MindMeld. We have a discount code. It was shared with you on the flyer that we sent, Scope 22. And if you were to apply Scope 22 here, then it would be a zero balance for the provider. All of their information is still collected, which is really, really handy for us because we receive a monthly spreadsheet, which includes email address and contact information. So we can follow up to see if the dental providers benefited from participating in the webinar or if they need additional resources. So I'll stop sharing here. All right, so I thought right now what we would do then is to go ahead and to take a quick look at the video. I'm just going to play a couple of minutes of it for you so that you can see what it looks like and kind of the tone of the video. Let me get it popped up to the right place. And I will share. Hopefully I'm sharing it correctly. Nope, I'm gonna push it over here. This is not wanting to cooperate with me today. All right, can you see Protect Your Sweet Smile now?
We see the dental professionals and continuing education
Oh
website.
my goodness, okay. Try this again. I did practice this, you guys. All right, let's try this again. How's that? Okay, so we'll go
Yes.
ahead and play the first couple of minutes here.
Continuing education presentation on sugar-sweetened beverages and oral health. Today, we will learn how oral health professionals can utilize existing public health messages and resources to advise clients on limiting the consumption of sugar-sweetened beverages. First, we will review the Rethink Your Drink campaign, how its core message can be leveraged by oral health professionals, and how to apply that messaging in your office. Next, we will review current nutritional guidelines and the impact of sugar consumption on dental decay and overall health. Lastly, we will discuss how to use communication strategies, including motivational interviewing techniques, to help guide clients toward healthier behaviors. It is our goal to provide you with a wide variety of helpful resources to assist your conversations with clients. The Sacramento County Oral Health Program connects people to dental care, provides oral health education and resources for the community. Goals of the Sacramento County Oral Health Program include efforts to increase the number of women accessing dental care during pregnancy, encourage consumption of fluoridated tap or bottled water, promote compliance with the kindergarten oral health assessment mandate, increase oral health literacy for all ages, and last but not least, to increase tobacco cessation and sugar-sweetened beverage guidance to clients in dental offices. Sugar-sweetened beverages are, of course, the subject of today's presentation. Dental caries is a public health crisis. Not only does it affect people's overall health, but also has socioeconomic impacts. Dental professionals can assist public health program efforts by leveraging the messaging of large-scale educational campaigns that focus on overall health to promote oral health. Oral Health in America, a report of the Surgeon General published in July of 2000, stated that oral health and general health should not and cannot be interpreted as separate entities. The major messages from this landmark report were that oral health is more than just healthy teeth. Oral health is integral to the general health and well-being of all Americans. Safe and effective measures exist to improve oral health and prevent disease, and health risk factors such as tobacco use and poor dietary practices affect oral and craniofacial health. As dental professionals and clinicians, you can integrate messaging from the statewide public health campaigns of the Tobacco Control Program and the Nutrition Education and Obesity Prevention Program to assist your clients in making healthier decisions. This is a great opportunity to leverage existing public health strategies and to be a resource for overall health information.
Okay, so that's just a little clip of the beginning of the webinar. I wanted to take you through. Does anyone have any questions about anything so far, how we developed it or how we finance it, those kind of things? if not, we can go ahead. Keiko, any questions that you have?
Yeah, so Jan, there was a question from Amber Volanti. She's asking if you can share who you contacted and the process of how your LOHP was accredited to provide the CE units for the Rethink Your Drink training.
We can, and I'll just put my email address in the chat. And you need to make an application through the Dental Board of California. You can do it through the Dental Hygiene Board of California as well, or however, it's a little bit more expensive to do it through the Dental Hygiene Committee, actually, I guess it's called. But you can do it through the Dental Board, and basically you need to have the curriculum developed. You need to have speaker bios. You need to have learning objectives and outcomes. So there's just a process that you need to do. You submit an application, I believe it was $400, and then that lasts for the first 2 years, and then you renew every 2 years afterward. But I can give you more information if you'd like to email me. Any other questions?
That is it for right now, Jan. Thank you.
Okay, so then I thought what we do is just go through and kind of look at the PowerPoint that I have of the different learning topics that we have highlighted in the video. Let's see if I can pull it up this time. All right, can you see anything now? What do you see?
Nothing right now.
All right, let me get out of here. Sorry.
So we see the video.
Well, now it's disappeared. Hang on one second. It's just your nightmare, what you don't want to have happen, huh? One moment. Okay. All right, so I just picked out a couple of slides. I didn't think you all would want to watch this from through the whole thing. So I wanted to just kind of focus on the main topics that we presented during the video. So first of all, we had a couple of primary goals. One was to offer dental professionals resources for offering sugar-sweetened beverage guidance to clients in their offices. And the other was to educate them about the major public health campaigns like Rethink Your Drink, so that they could leverage those messages and maximize impact. We talk about overall health risk. One of the things about the Rethink Your Drink campaign, while it does focus on heart disease and obesity, there's not a lot of discussion about the health risks of sugary drinks to dental disease. And so we thought this was a great opportunity to integrate the messaging. We gave them a lot of data about how much sugar is consumed and how that impacts their health. 30% are more likely to develop heart disease when they consume 10 to 25% of added sugars daily. We talked about the oral health risk to children in terms of caries being the #1 chronic disease in children. Surprisingly, dental professionals aren't always connected to public health resources. So while they understand it from a clinical level and what they see in their offices, they may not be as much in tune with the bigger public health picture. We discussed how many school days, 440,000 children ages 5+ missed at least one day of school for a dental concern. Of course, this extrapolates out to adults. Adults who have untreated tooth decay are likely to go on to lose teeth. And we talk about the financial impact. Not only is this a personal impact to people's health, but also it is a societal, it has societal costs. We have studies that show that $39.4 billion per year is spent on diabetes-related expenses, $9 billion per year on obesity-related medical expenses, and $29 million per year is lost to missed school days due to dental concerns. We also shared some advocacy and initiatives that have been undertaken in California and actually worldwide to reduce the consumption of sugar-sweetened beverages, including requiring restaurants to offer water or unflavored milk, updating labels to have safety warnings, limiting the container size for fountain beverages, and of course, taxing sodas and other sugar-sweetened beverages. The average American consumes about 17 teaspoons per day. That equals about 57 pounds of added sugar every year. We thought that was a pretty astonishing amount. 62% of adolescents and 41% of children drink at least one sugary beverage a day. So there is a big market for education. We shared during the video the recommendation made by the USDA that people consume no more than 10% of their daily diet on added sugar, and that's based on a 2,000 calorie day per diet. We know that not everyone can consume 2,000 calories per day, so they would have to adjust their intake accordingly. The American Heart Association has made it simple. They recommend 9 teaspoons or less of daily sugar for men, 6 teaspoons or less for women and children, and no added sugar for ages 0 to 12. So we wanted to take the overall messages encouraging of Rethink Your Drink, which are to encourage consumption of water, to identify the health risks of sugar, the overall health risks, and add in some messaging that they can use to teach their clients and patients in their offices how to understand sugar read messaging and those kind of things. So we first identified the different types of sugar. There are 50 or so different types of sugar, and so it's really important to learn to read labels. On labels, ingredients are listed in the order of predominance in the product from highest to lowest. So if you scan the first few ingredients, you get an idea of what you're consuming. So as you can see here, the first ingredients are carbonated water, high fructose corn syrup, sucrose, and the fourth ingredient is orange juice. So that means it's mostly water. The second, third, and fourth ingredient are sugars. Also, there are acids, and we'll discuss those a little bit later. So in 2016, the nutrition facts label was updated by the FDA, and all of the food manufacturers should have been in compliance by July of 2021. The new label shows that the calories and the serving size are bolder and in larger font as opposed to the old label. They've added a line for added sugars, which can be really confusing to try to figure out, particularly for people who are watching their carbs. If they're trying to do a low carb diet, sometimes people will deduct the dietary fibers. So this added sugar line gives a little bit more information. And then the nutrient list has been changed about what is required from vitamin D, calcium, iron, and potassium. Vitamin C is no longer listed. They can put it on, but they don't have to. So how do you calculate sugar content? What you do is you take the total grams of carbohydrates and you divide it by 4. So I think now it's a pop quiz. Keiko, can you launch our poll? How many teaspoons of sugar are in this 20-ounce bottle of soda? Take another couple of seconds. All right, I think pretty much everybody who is going to answer did answer. So we'll share the results. So it looks like about 71% of the people who answered says that it was 16. And in fact, you're right. It's 16.25 teaspoons of sugar. So what would happen is you take the 65 grams of carbohydrates, divide it by 4, and you get 16.25. And that helps you determine how many grams of sugar that you're trying to stay into or trying to consume based on the recommendations. Also, we provided for the dental providers basically a patient's eye view of cavity formation. So this is beyond what most dentists are beyond this, but we wanted to provide a patient's perspective. So basically, if you have plaque bacteria on teeth and you consume carbohydrates, either sugary beverages or other sticky carbs, the bacteria ingest that creates an acid. The acid breaks down the tooth structure and causing tooth decay. It's a really fluid process. If you use fluoride or other things or brush your teeth, those kind of things, then you can minimize the amount of acid that's produced in your mouth. We talk a lot about pH because acid produced in your mouth obviously lowers the pH. And if you consume sugary beverages that also include acids, then you are really putting a burden on your oral hygiene. We looked at the different types of sugar-sweetened beverages, including energy drinks, sports drinks, cola, coffee beverages, and found that most of them are very acidic. This really interacts on the pH on your mouth. There are different ways that you can prevent that, but basically once you get under a 5.5 pH, you're having deterioration of the hard structures, the enamel of your teeth. So after kind of giving that brief review, we talked about behavior change strategies that clients could make in order to make better choices. So protective behaviors that they can do for themselves is to consume sugar-sweetened beverages with meals rather than to having a big gulp sitting on your desk and taking sips throughout the day, which constantly lowers the pH. If you're going to have a beverage like that, just go ahead and drink it, get it over with. Once you drink a sugar-sweetened beverage, immediately rinse your mouth with water. You can eat a piece of cheese right after consuming a sugary drink. That milk proteins help protect from the acid. Chewing a piece of sugarless gum will increase salivation and help return your mouth to normal neutral pH. And then also, if you just had a big sugary meal, you might not want to brush right away because that can etch the tooth surface. So you want to wait for about 60 minutes. We again pull in the Rethink Your Drink campaign by suggesting what to do instead of sugar-sweetened beverages. Drink water, plain or flavored with fruit, vegetables, or herbs. Drink unsweetened seltzer water, coffee, tea, sparkling water, or low fat-free or low-fat milk. We listed 100% fruit juice, which of course contains sugar, but if you are going to have juice, often we recommend to dilute it 50-50 with water and only have 100% fruit juice, not fruit juice with added sugar. There are also protective measures that dental providers can suggest for their patients, including dental sealants, 5% sodium fluoride varnish applications, prescription fluoride toothpaste, xylitol products, including chewing gum that has xylitol and sugar-free, increases saliva, and then the ACP products, which are a milk protein based medicament that helps to remineralize some of the minerals that have been lost to the pH changes. We talk a lot about fluoridation because this was a way for us to add in fluoride to the discussion, so integrate another objective from our work plan. Fluoridated water does have topical and systemic benefits. We did a community oral health needs assessment, as most of you have done. And one of the questions that we asked is there fluoride in your water? And we got 1,705 community responses. And what we found that only about half of the respondents said that they knew whether there was fluoride in their water. So we learned that there was a lot of room for education. People didn't know whether their water was fluoridated or not. They did know that fluoride was beneficial, however. So time for another pop quiz. Do you know if the water in your home is fluoridated? Okay, go. Okay, last chance. All right. So I'll close the poll, share the results. And it looks like about 76% of you know whether your water is fluoridated. 9% didn't know, or excuse me, knew their water was not fluoridated. Not a good question. And 15% didn't know whether it was or not. So that just shows us that some people don't know whether their water is fluoridated or not. And so we're kind of lucky in Sacramento County. We have our waters about 65% fluoridated, and First Five California, First Five Sacramento does generate this map. It's a really useful tool for dental providers in our area to share with clients. They can look where they live on the map to see whether they are receiving the benefits of fluoridated water. If you don't have a map like this, you can go on to My Water's Fluoride, the CDC site, click your state, and it will tell you what water districts in your area are providing fluoridated water. So that's a useful tool when guiding clients and having discussions about water fluoridation. Other things we did was in the video, we talked about the different communication strategies and tools that are available for dental providers to use. There's the medical history and CAMRA. CAMRA is the caries management by risk assessment. So basically interviewing clients about their habits, behaviors, and how frequently they're taking in sugar beverage or other sugary products. Anticipatory guidance, just explaining to parents about the importance of oral health and oral health care in infants and children as they grow, letting parents know that oral disease, the bacteria that causes caries, is transmissible. So it's important for them to take care of their own health, oral health as well. The 5 A's: ask, advise, assess, assist, and arrange, which is that tobacco strategy that can also be applied to sugar-sweetened beverage behavior change, and then motivational interviewing strategies. This really ties in with our resources. Our number one resource is the When Sugar Is Not So Sweet guide. This brief guide that includes simple visuals and messages that dental providers can use to talk with patients about reducing and eliminating sugar-sweetened beverages to reduce decay and other associated chronic diseases. It also helps clients come up with a plan to help reduce or eliminate their sugar-sweetened beverage consumption. They do talk about motivational interviewing and different strategies in this resource. Other resources are the American Academy of Pediatrics, ILikeMyTeeth.org. It's a great website for oral health information. The ADA Say This Not That tips for talking about community water fluoridation. Fluoride is somewhat controversial, and sometimes it would be helpful to have strategies for how to communicate the benefits of fluoridated water without engaging in a controversial topic. There's the fluoridation learning online. This is actually geared toward water operators and engineers, but for our staff members who have not, who don't have a dental background and would like to know about water fluoridation, the benefits and the process by which it's delivered, this is a great tool. Fluoridation facts from the ADA is also a great resource because it gives facts, so that sometimes people will come and they'll have myths that they are promoting that they've learned outside on the internet or something. And so fluoridation facts really helps to debunk some myths. We also have resources for patients. The Sip and Snack All Day Risk Decay handout that dental providers can hand out is from the ADA. It talks about not only sugar, but acids. It's one of the few pamphlets available that discuss both. There's the drink pyramid, which is just a helpful little tool for parents. Pop only at parties, juice just once per day, milk with meals, and water whenever. That's a nice resource. Also, Potter the Otter, a tale about water. And then the Choose Health Drink Water flyer. That's also another Rethink Your Drink resource that shows how many minutes of walking it would take to walk off however many teaspoons of sugar you drank in your beverage. Of course, COTAC, the California Oral Health Technical Assistance Center. They have wonderful resources on every topic imaginable. We list all of these resources on a page that dental providers can download once they take the video. And I think we provided that to you in your program handouts. We also send people to our oral health program website, saccountyOralHealth.net, and they can find all kinds of information, including how to access the video and information on sugar-sweetened beverages and all kinds of other things. And that, I think, is it as far as the overview of the topics that we used in the sugar-sweetened beverage. So if you have any questions, I see Stephen Starr. What's terrible, Stephen? I'm looking at the chat.
I think he was probably commenting on how much sugar is in the
Oh,
drink.
it is, it's amazing. Yeah, there's a ton of sugar. So that's what we have. If you have any questions, I'm here to answer them. So this resource is available on saccountylearning.net. If you are working on this or would like to work on this and have a resource for dental providers in your community, then you would have to make an arrangement with MindMeld. Basically, if you wanted to budget some funds in so dental providers could view the video at no cost, they would charge a program, or you could just use it and have the dental providers pay the $5, which is completely reasonable for 1 hour of continuing education. And within the next week or so, we will be posting, I'm sorry, I'm trying to read as it goes up too. Within the next week or so, we will be posting the tobacco cessation webinar. I think that Stephen had a question, if someone doesn't want the CE, can they view it for free? So this was tricky. We really wanted to do the CE. We wanted to do that as an incentive. And so at this time, you cannot view it for free. Also, the CE, as you can see, the work plan, the objective of it itself changed a bit over time. Originally, the work plan was to promote sugar-sweetened beverage guidance to dental professionals, and that's where we focus. So this video is really aimed at dental professionals versus the community at large, although people could get good information from it. I'm happy to share slides if you'd like. I can send them to Keiko and she can send them out. But this is available to all of you. You can use it, Sac County Learning, contact me, and we can, I can let you know how we went about offering this to dental professionals. We'd really like it to be a great resource. We took a lot of time and money to produce this. We were very lucky to have those braided funding resources available. And so we hope it goes to good use.
And Jan, there's a question in the Q&A. It's asking $400 is the cost. Is it independent on how many CEs you provide in the period of 2 years? Can the $400 be billed to Prop 56 grant?
We did bill with permission. That is no matter how many, CEs. You do have to submit the curriculum, so you have to have that ready. You do have to have your course outline and objectives ready. You need a speaker bio, someone who is considered. You'd have to read the. Dental board application, but basically you need a subject matter expert speaker, and that would be held to the same standards as any university speaker. So look at those requirements and see if you could come up with that. And then you have to keep all the records of all the attendees, generate and send their certificates of continuing education. So there's a lot of admin behind it. You can do it, but it just depends on how much admin time you have free. Well, are there any more questions, Keiko?
Not at this moment, but if everyone would like to, if there's any questions for Jan, please go ahead and type it in the chat box or the Q&A box. But I do want to read some comments. It's saying that this is an amazing resource. These resources will be great for LOHPs and dental offices. So thank you so much.
Thank you. It was a labor of love, and the tobacco video has a completely different look or feel. It is more of a documentary style, and we were able to have as our talent for the video Christina Mendonça, who is a local newscaster here in Sacramento area. So I think it's going to be really fun. If you'd like, we can take the next couple of minutes and then just see a little bit more of the video. And we might end up getting out a little bit early, but please do contact us if you have any questions or if you would like to have access to these resources for your dental providers in your community. Places where we go out, if you have a dental hygiene school, we plan to offer this to the dental hygiene students, dental assisting students, other students. Students don't need CE, but they would benefit from viewing the course. So I think that even if we fund it on our budget for them to view, it's beneficial. So I think I will go ahead and start the video a little bit sooner, see if I can pop it up somewhere. Bear with me a moment here. I'll get it to the right place. All right, this is approximately the right place. So this part of the video is about the communication tools. This works really, really well with the When Sugar is Not So Sweet guide, because that does discuss motivational interviewing.
Dialogue. What tools you choose to use is based on your personal style and the time you have available. We will discuss medical history and Canberra, anticipatory guidance, the 5 A's, and motivational interviewing strategies. An easy first step is to implement caries management by risk assessment into your practice. CAMBRA is a standard of care that involves identifying the client's risk for caries through individual assessment. CAMBRA assessment forms for adult and child clients are available for download with permission on the American Dental Association's website. Or you can add questions to your existing client medical history form. Here are some examples of questions that can be easily added to the medical history review to assist in assessing caries risk. For pediatric clients, is the client getting fluoride through drinking water, toothpaste, or topical applications at school or at their medical or pediatric office? Is the client consuming sugary foods and drinks, including juice, soft drinks, energy drinks, and medicinal syrups? How much and how often? What is the caries experience of the mother, caregiver, or siblings? The bacteria responsible for dental caries are transmissible. It is essential to educate the parent or caregiver on the significance of family oral health. And does the client have special needs that would prevent adequate oral home care by themselves or a caregiver? For adults, questions related to eating disorders, alcohol, drug use, and radiation treatment may be added to help understand the risk for decay. For all clients, observations from the clinical examination help to guide overall risk determination. Identifying high risk due to consumption of sugar-sweetened beverages through CAMBRA can help launch the Rethink Your Drink discussion. This approach takes minimal extra time when going through a client's medical history. Another tool that can be used is anticipatory guidance. Anticipatory guidance is a proactive technique that guides a client toward a specific goal. The aim is to customize the education provided to clients based on anticipated upcoming behavior or events. For example, expectant parents will appreciate learning that dental care is safe and important during pregnancy, and that the bacteria responsible for caries is transmissible between baby and caregiver. There are also several milestones that parents will encounter with their children. These include teething, timing of first dental visit, appropriate use of the bottle, mouth hygiene for infants, injuries, and more. Providing information in advance of events helps to pave the way toward good oral health. This approach can be easily integrated into existing education and will take just a few minutes. Another approach that can be used is the 5 A's, which consist of 5 major steps adapted from tobacco intervention programs. The steps are ask, advise, assess, assist, and arrange. This approach seeks to evaluate the client's willingness to tackle behavior change and then to provide tools to assist them. Using the 5 A's approach takes about 5 to 7 minutes during an appointment and requires a follow-up conversation. Because of this, this approach might be reserved for clients with extreme or recurrent caries or health conditions influenced by sugar intake that can result in poor oral health outcomes. For these clients, 1. Ask. Identify and document sugar use status for every client at every visit. 2. Advise. In a clear, respectful, sensitive, and personalized manner, urge every client to reduce sugar consumption. 3. Assess. Is the client willing to make a behavior change? Visual tools to assist with assessment are available on the resources page. 4. Assist. For the client willing to make a behavior change, offer resources to help him or her reduce sugar consumption. 5. Arrange. Schedule a follow-up contact, in person or by phone, preferably within 1 week of the discussion.
There you go. So that is part of the communication strategies. The next part would be on motivational interviewing. I'm not sure if anyone has any other questions. Keiko, or?
Yes, actually, there is a question, Jan. It's asking, what do you think of recommending diet sodas as a sugar-free alternative?
It's a good question. From the sugar standpoint, the sugar is not going to elevate their blood sugar. It's not going to have an impact on the acid in their mouth. However, diet sodas may contain acid. We talk about them in the videos: citric acid, phosphoric acid, acids that are often added to all beverages. So the drink itself may have a low pH, even though it doesn't have sugar. So I would say, even for a person who, it would, depends on the person's risk. If they are not at risk, they might be able to enjoy one of those once in a while. However, if they are at any risk at all, then they probably would want to avoid that and drink water. Fluoridated.
Great, thank you. Okay, well, we still have a little bit more time. So if there are any questions for Jan or Jessica, please go ahead and type it in the Q&A box or chat box.
I think, one of the hardest things is to market. So we got a little bump. We sent it to the Sac Valley Dental Hygienists Association. We distributed flyers last month at Sacramento District Dental Society. So we're still looking for ways to market this. Again, we don't make anything from this. The $5 that is paid to Mind Mill is strictly for the administration of the continuing education credit. So time will tell whether this has been a good strategy and it will encourage dental providers to use it. I'm really hoping that you all will use it in your communities. I think it's a good way to interact with the dental community and give you an opportunity to build your email list and those kind of things, where you can reach out to those providers when you need to offer resources and to just be informing them about the things that are going on in the public health space. You all are very quiet today, so you probably need a soda. I'm kidding.
Okay, so there's another
I'll be like Dr. Kumar says about tobacco. Go ahead and buy it, just don't drink it.
Right, Jen. Okay, there's another question. It says, for adults who struggle with drinking water and even infused water, how do you recommend someone to start on their Rethink Your Drink journey?
Well, I think some of the tools and strategies that are offered, motivational interviewing and those kind of things, that we can actually watch that if you want, and talk about how to identify what motivates the patient. So we're motivated to get them to stop, but what we need to do in motivational interviewing is to pull from them what a motivating factor might be. Would you guys like to watch a little bit more of the video?
I think that'll be great. Thank you, Jan.
Okay. Of course, I can find it again. All right, we'll just continue from where we were. Let me share. And the next part is about motivational interviewing, which I think will answer your question the best.
Lastly, we will review motivational interviewing.
Excuse me, Jan. I think the audio went out. Okay. Well, just be a moment until we get that video going again. But again, I would like to use this time to encourage, if anyone has a question, please go ahead and type in the chat box or the Q&A box.
Let me try now. I'm not sure why it quit there. Hang on one moment. Can you hear it now?
Nothing.
Lastly, we will
Yes.
review motivational interviewing strategies.
I think the audio went out again, Jan.
And with respect for client autonomy,
Better?
Better, thank you.
focusing on positive behavior, and with an attitude of non-judgment. Compassion, offering earnest support and empathy for difficult behavior change. Evocation, drawing out from the client what is important to them and what changes they would like to make. The OARS communication technique can be combined with motivational interviewing to help guide client conversations. OARS uses open-ended questions, affirmations, reflections, and summaries to help establish and maintain rapport with the client, to help assess their needs, and to guide your recommendations. Open-ended questions require more than a yes or no answer. This allows time for clients to carefully consider their responses. In turn, this provides clinicians more information to guide the process. Generally, open-ended questions begin with what, when, where, who, and how. Examples of open-ended questions related to sugar consumption include, what would happen if you consumed less sugar in your diet? On a scale of 1 to 10, how likely are you to consume less sugar in your diet? What do you know about the acid content of beverages? How much sugar is in your favorite sweetened beverage? Tell me more about that. Affirmations focus on client strengths. This technique complements past efforts and empowers success. An example of an affirmation might be, you should be proud of the healthy choices you've made since we last spoke. Reflections are used to mirror something someone has said to you. Reflective statements show clients that you are listening. Reflective statements also allow the client to hear what you heard and make corrections to avoid misunderstandings. This is a powerful communication tool. You can reflect words such as, some of what I heard you say is, or you can reflect emotions such as, you seem to be disappointed. And you can reflect behavior such as, I notice you don't seem yourself today. Finally, summaries are a series of reflections that enable you to succinctly deliver a conversation back to a client to ensure your understanding of the client's goals and preferences. With practice, OARS communication techniques can help to personalize the guidance and education you provide for your clients. Audio and visual aids are great tools for client education while using the motivational interviewing technique. Simple visual aids with pictures can help the client clearly understand as you ask questions and facilitate the conversation.
Okay, you can see the When Sugar is Not So Sweet resource guide, if printed and at the dental office, really has a lot of excellent resources for guiding patients through that kind of conversation. Any other questions?
Yes, Jan. So I just want to read a comment first and then we'll go into the question. And this comment is from Cherie Sprouse. She said, in addition to motivational interviewing, a good tip is to start small, reduce the sweet sugar beverage consumption over time, and it can take 12 weeks or more for behavior change to become a habit.
That's excellent.
Okay, and then a question here says, are the CEs strictly for dental providers, or could primary care providers also get CEs?
You would need to ask MindMeld. You know, we focused on dental providers, but if you were working with MindMeld, if you're talking about the dental board permit that we got, it's just dental. If you're on the Mind Meld site, you saw that little drop down box where they have a number, they can do legal CE and all kinds of different CE. So you would have to ask them whether they have it for the particular group that you're looking for. I don't think they have one for the medical board, but they may have for nurses, I'm not sure. So that'd be really great though, right? Because now that our objective, formerly known as 8, which is now 4, includes community health workers, there may be medical assistants and others that would benefit from taking the training. But again, I don't know about Mind Meld's capacity.
Right. And I don't see any other questions or comment. Oh, actually, I'm sorry. Let me go back to Jessica. She put a comment regarding what Cherie was saying about the 12. It takes about 12 weeks for behavior change. Jessica commented that additionally educating on the effects and the process of how sweet sugar beverages and sugar consumption causes tooth decay. That was a comment.
And we do go through that more at length in the video, but didn't put it up today.
And there's a question here, Jan. I guess it says, it's important to know dealing with chronic soda consumption is a bit more than behavior change. It is an addiction. Sugar is most addicts' first addiction.
We do talk, we really get into that more in the tobacco video, the different types of addiction, physiological, psychological, and habitual. So you're right, it is an addiction, but even addiction needs behavior change and, you know, getting down to the core motivation, bringing a person's core motivation to the forefront is the first step in identifying what would motivate them to make a change. All right, well, it looks like we're about out of questions. We definitely invite you to visit. I'm going to put our link to our website. Make sure I have it there. You're welcome to visit. This resource is linked on the dental professionals page. There's also a page with sugar-sweetened beverage guidance for patients and community members who visit the site, along with all kinds of different information on oral health during life stages and resources for COVID, those kind of things.
Well, thank you so much, Jan. And
you're welcome. I think we're going to give you back some of your time, which you guys will probably appreciate. And I thank you so much for joining us today. We're really excited about this, and we hope that some of the dental providers in your community will be able to take a look and keep watching for the tobacco video. That's going to be a good one too.
Great. All right.
I see a raised hand. Was that Sherry?
Does she have a raised hand? Let me take a look. I don't see any further comments or any questions here.
Perfect.
But I do want to say thank you, Jan, for sharing the resources. We put that on the chat box, but the resources as well as the recording and Jan's PowerPoint will be posted on COTAC's website by tomorrow. So they'll be all up there. And again, if there are no more questions, I would like to just thank Jessica for providing an overview of the work plan for the Objective 8, and also Jan for sharing a variety of great resources, strategies, and tools for the dental providers to share with their patients and community. Maybe I would invite Jessica if she has any last words she would like to say.
Sure. Yeah, I just want to thank Jan as well for sharing this resource. I hope all the local oral health programs find it helpful and a great resource to share in their communities and with their dental providers. If you guys have any questions regarding work plan, your person, so you can email me. If you have specific questions for Jan's training, you can reach out to her. But I think it's just a great, really comprehensive training that Jan and her team put together. So I encourage you all to utilize that in your work plans.
And I think, Jessica, so just yesterday, everything changes so much. I don't want to put you on the spot, but I believe you authored an article on sugar-sweetened beverages as well, right? So that would be a great something to share with the group, because it's much more scientifically oriented than this video.
Yeah, it's sort of a literature review. It's available on the COTEC site. And then in reminding you all that the When Sugar's Not So Sweet guide is also on the COTEC website. So that's also another great resource, which is included in Jan's training, but something that you could even, print out and use in your dental offices, and then also provide some training to dental providers.
Yay. Thanks,
Wonderful.
everyone.
Yeah, thank you so much. And again, thank you to our presenters and audience for engaged session. I just wanted to remind that there is going to be a survey following the close of this webinar. So please go ahead and complete the survey. And again, thank you, everyone. Thank you, presenters. Everyone have a wonderful day.
Thank you.
Thank you.
Thanks.